tonight with the new developments on the coronavirus. Good evening. I'm Mike Montecalvo.
And I'm Shannon Hogy. Clinical trials are underway for a treatment as the virus continues to spread.
And here in the U.S., health officials are telling people not to panic, but to be ready in case the coronavirus becomes widespread here.
Eyewitness News reporter Caroline Goggin spoke with a doctor at Rhode Island Hospital and joins us now from Providence with the latest developments.
Over the past few weeks, Lifespan has been working to formulate a plan in case the coronavirus were to spread here in the U.S. That protocol would protect both patients and staff in the hospital. And tonight we spoke with a doctor who said the most important message for people at home is not to panic. Coronavirus concerns on the rise after the CDC warned on Tuesday it expects the virus, responsible for almost 3,000 deaths worldwide, to spread here in the U.S. Dr. Selim is the director of disaster medicine and emergency preparedness at Rhode Island Hospital.
Everybody probably has gotten a coronavirus infection in their lifetime. It's the common cold.
But Dr. says this specific coronavirus is different because it spread from an animal species to a human.
It's new, and our body has never seen this virus, so we have a reaction to this virus that can cause severe illness in certain populations.
He says it can attack the upper and lower respiratory tracts, causing sore throats, sneezing, runny nose, cough, and pneumonia. Dr. says the elderly are most at risk, and that unlike the flu, kids won't be affected as much. In response to the possible spread here at home, says Lifespan has formulated a plan. It's looked at its inventories to make sure they're stocked up on masks and other protective equipment for both patients and staff.
We think about if there are large numbers of patients, how would we accommodate that surge in our hospital, whether it be an outpatient surge or an inpatient surge.
On Tuesday night, San Francisco became the first major American city to declare a state of emergency in light of the virus. Dr. says it's likely inevitable the virus will spread in the U.S., but for now, he says there is no need for people to panic.
There has not been large numbers of transmitted cases in the United States. And if and when that happens, I think the United States is prepared for that.
Senator Jack Reed is also urging Congress to pass legislation that would provide an additional $3 billion in federal funding in response to the coronavirus. He's also urging President Trump to appoint a public health professional to lead the federal response. Reporting inside Rhode Island Hospital, I'm Caroline Goggin, Eyewitness News.